Thank you so much for taking the time to speak with me today. I really wanted to get some of your input. You have been pretty vocal on social media and also, in the ledge just regarding the government's handling of the pandemic. More specifically, though, here locally, I just wanted to get a sense of where you think Halton is at during this pandemic and where you think we should be going.
Yeah, no, for sure. So listen, I know the pandemic has been an extraordinary struggle for families right across Ontario, of course, including in Halton region. And it's been really tough. It's been really tough on everybody, whether you're someone who's got a loved one in a nursing home, or you're running a small business, or your kids are in elementary or secondary school, like my daughters are. One's in grade 8, one's in grade 4. So I know how much of a struggle it's been. I think that earlier in the pandemic, when the first wave kind of hit back in March, it was completely understandable that governments at all levels were scrambling because of I guess, the unprecedented nature of the crisis. But we are now 8, nearly 9 months into this pandemic. We are squarely in a second wave that's very tough. And what I found deeply disturbing is that it's been clear since September that Doug Ford doesn't have a real plan to deal with the second wave. There's been a lot of confusion and chaos. He now spends a lot of time lecturing the people of Halton and the people of Ontario about how they should be behaving, which is fine to an extent, but I think the government and the Premier in particular have a responsibility to set clear guidelines, to not be confusing, and to have a really coherent plan to help regions like Halton navigate through the second wave. And so far, we've not seen that.
So then what would you say would be a reasonable plan for Halton if you had power and if you had say and if it would have gone far enough with the current government?
Yeah, no, absolutely. So the one place where Doug Ford has dropped the ball since March all the way through without any interruptions is how we go about doing our testing for COVID-19. We saw just a couple of days ago, province-wide, we only did 26,000 tests. We should be doing 50, 60, 70, 80,000 tests per day, every day. Every place in the world that's had success dealing with COVID-19 has had a very strong testing and tracing regime. We don't have that in Ontario. I think in places like Halton, Peel, my home region of York, the city of Toronto, which we know are the areas that are struggling just a little bit, we should have more testing capacity in place, perhaps more pop-up testing in place, in particular in neighborhoods or areas of those regions that seem to be struggling the most. And at the same time, I know how hard it's been for small business entrepreneurs who've literally been battered throughout this pandemic. They faced a lockdown back in the spring. They've now seen modified stage 2 or other restrictions. Doug Ford's talked a lot about providing those small businesses with relief, but from every small business owner I've spoken to, it's not at all clear how to access that relief. And so it seems to me that there's a lack of urgency around keeping those small businesses going. So it needs to be both a lot more testing, a lot more contact tracing, and real relief for those small business owners as they're struggling.
Well, isn't it? It's certainly hard to balance both because with our current numbers as it stands and the projections that we could be going to 6,000 per day by December, how do we balance, local economy and also keeping people safe when really should we even be in another lockdown? Our numbers are much higher than they were in the beginning.
Yeah. So I think one of the things that's been a challenge, and this goes to the issue around confusion, Doug Ford does talk an awful lot about balance. And look, I'm a liberal, so normally balance is exactly what I love. It's how I approach politics and governing. But what we've seen with this virus is that if you don't get it under control and you ultimately have to face a second across the board lockdown, which is what nobody wants. I don't want it. Nobody I've spoken to wants an across the board second lockdown at this stage. You do have to take decisive action to get the virus under control. It is a public health crisis first. And if you do that successfully, and if Doug Ford had done that decisively and successfully starting in September, we would be in a much stronger position on the economic front. The fact that he's been so confusing for so long, the fact that we learned he ignored the advice from Public Health Ontario, he set the criteria way too high for places like Halton and Peel and York and Toronto and Ottawa that made no sense based on no scientific or public health advice whatsoever. The fact that he's taken so long and still we are failing on the testing front. The fact that we had to live through the heartbreaking stories coming from long-term care back in the spring, and yet here we are again with more people dying in our nursing homes as we speak because Doug Ford has frankly betrayed them and their families and those who work in those nursing homes. So there is just so much that is being left to be desired by Doug Ford, not decisive enough, not recognizing this is a public health crisis first, and not putting relief in place for small businesses that's easy to access and easy for them to receive on an urgent basis.
So, am I correct to assume that if you had the choice, if you had the power, would you put us in a lockdown?
I wouldn't do it. I wouldn't do a lockdown at this stage. I still think that there are ways to do more targeted features or more targeted approaches that we could be using, but a lot more aggressive and a lot more clarity. And look, here's something else I'm going to say, which I know most politicians won't say, but I'm kind of tired of hearing only from the politicians and not so much from the public health experts. I think one of the best things Doug Ford could do would actually be to take a step back from the cameras. Of course, as a premier, you still want to be providing regular updates. But in addition to Dr. Williams and Dr. Yaffe, let's put some of the other public health scientists and leaders that we have at our disposal, incredible expertise that we have in our ranks here in Ontario. Let's bring them forward. Let's reveal what the command table's advice and public health's advice has been to Doug Ford all the way through. Doug Ford shouldn't be afraid of transparency. I find that the more information you give to people during a crisis, you help them make better informed decisions as they go forward. So too much secrecy, too many lies, too much betrayal. It just doesn't make any sense in it. And the numbers are going in the wrong direction.
Let's move on a little bit to now the zoning. I talked about that a little bit with you. For Halton, do you think it's a fair spot, considering in the beginning our numbers weren't as high or as dire as those of Toronto and Peel, for example? Are these designations fair, and in particular, should Halton be in a red zone?
So I think that now that Doug Ford got caught ignoring the advice of Public Health Ontario and had to revise his own criteria and bring it down to a more reasonable level, which means that Peel and Halton and Toronto and York, again, my home region, are kind of captured by that red zone status. Look, I do think that makes the most sense. It seems to me at this stage, as tough as it is, to be based on the very best public health advice. But again, I don't think it can be just either or. I do think, and I know I've heard it directly from the candidates that we have who are running for us in places like Halton and Peel. I've heard it from boards of trade, chambers of commerce, business improvement associations. Small business owners are really suffering, and everyone is extremely scared about a potential second across the board lockdown. What's this going to mean for the holiday shopping season? So people are scared, and I think it's no longer good enough to just say the right thing from the podium. I think that urgent relief for those business owners, so they can pay their leases or their rents, so they can pay for whatever inventory they might have to sort of deal with storing on their shelves, so they can pay their employees and not have to fire people, especially at holiday season, so they can keep their lights on. Those are the things that you can kind of touch and feel if you're a small business owner. And every single entrepreneur I've spoken to, from someone who runs a small little retail store to a medium-sized manufacturing business, just can't understand how to access Doug Ford's relief. And this is 8 or 9 months into the pandemic. It's not acceptable.
We haven't touched on yet. You talk about the local economy and businesses, but what about our schools? Where are we with that? Should Halton schools be shut down? Should schools everywhere be shut down?
Yeah, so look, as a parent, I will say to you, my wife and I, obviously, all the way through, like millions of parents across Ontario, have had a ton of anxiety since the summer about what Doug Ford's reopening of schools would look like. Now, long before Doug Ford presented his plan for the reopening of Ontario's public schools, I put out my own alternative plan. It was sort of built around the notion that class sizes had to remain small. I recommended a hard cap of 15 students per class, both at elementary and secondary. I think if the government had done that, it would have given parents a lot more peace of mind, and more parents probably would have felt comfortable sending their kids back to school. There's a huge and important reason that we should all want, as long as they're safe, that we should want our kids back in schools. It's good for their mental health. It's good for all of those other things that we know kids need. It's also the best way to learn. It's really tough to learn through a screen, especially for kids who have special needs. And so I think the biggest challenge, nobody I know, certainly not my wife or I, want a full lockdown of schools right now. We've heard reports coming from the Minister of Education that perhaps they're going to extend the winter break. I would be open to that. But here's the most important thing for me. When our kids go back to school in January, whether it's a week later or 2 weeks later, again, It's never the wrong time to do the right thing. Doug Ford can, over the time that the schools will be closed over the holidays, make the effort, make the investment, shrink the class sizes, bring more teachers online, provide more support to our school boards, including those in Halton, so that we can guarantee the safety of our kids and their families and our frontline education workers for the balance of this school year. I'm fearful that instead Doug Ford will take the easy way out, which is we're just going to shut the schools down for an extra couple of weeks, but we're not going to do anything else. We're not going to lift a finger. We're not going to make any other efforts. And from what I've heard for talking to educators and frontline staff in schools, there's an incredibly high burnout rate. I know the teachers in my own daughter's schools and the principal and others that I've spoken to, they're exhausted. I think we have to be really careful about their mental health as well to make sure that the entire system doesn't sort of collapse upon itself before we get to the end of the school year. Based on past performance, I'm really nervous that Doug Ford doesn't value publicly funded education and therefore, again, will not get it right on the other side of the holiday break.
Could I ask, though, wouldn't that cost millions and millions of dollars? And is that something Ontario has to invest into? Because that would require, obviously, more dollars to hire teachers,
Sure.
finding
Yeah.
more spaces, different spaces, being unique. That's going to cost a lot of money, isn't it?
Yeah, it would cost not just millions, it would cost hundreds of millions of more. But here's the thing, it's an investment, and I'm okay with that. You know, when I think of my daughters who are in grade 8 and grade 4, and one daughter's in a class of 27, the other's in a class of 26 or 25 on a regular basis, I know they are not 6 feet apart on a regular basis. That makes me nervous. I'm very privileged. My wife and I are blessed enough. We have the means, and the work that we both do permits us to work from home as needed. But there are millions of Ontarians who don't have that option. And it hits moms in particular across this province. We have seen the participation rate in the workforce of women drop precipitously during this pandemic because so many have been forced to choose their looking after their kids rather than going back into back into their careers. We're not going to have a really safe reopening and revitalization of Ontario's economy unless moms and dads truly have the peace of mind that they need and unless the school system is resilient. So when I think about the money that's needed to get this right, I look at it as a political leader as an investment in our economy, not just in the school system itself. And the problem is that I don't think Doug Ford values publicly funded education. Prior to the pandemic, we saw how much churn and disruption there was in our school systems with all the labor strife that was taking place. Now, I just don't think he wants to make the investment that's required in order to make the system as strong as it possibly can be. And I think that's a real problem on the economic front as well as the social front.
You touched on it there a little bit, but you talked about the women being one of the most affected by all of this. What would you have liked to have seen, or would you like to see in terms of more support for women during this pandemic?
So number one is it all comes back to the safe reopening of schools. I don't remember the exact number in Halton, but I know across Ontario, depending on the school board that we're discussing, anywhere from 15 to 35% of parents have decided to keep their kids at home rather than have them back in school. And that mostly is, as far as I'm concerned, that mostly is because of the anxiety those moms and dads have because Doug Ford's plan was not strong enough or properly funded back in July and August. And so all of that anxiety and confusion Doug Ford caused, I think compelled a lot of parents to choose keeping their kids at home when deep down they would rather their kids be back in school as long as they could be kept safe. So number one is making sure that our school system is designed in a way that gives moms and dads, but mostly moms, that peace of mind to go back into the workforce knowing that their son or daughter is safe while they're learning at school. Secondly, looking at things like before and after school care. We here in Ontario, particularly in the GTHA, before and after school care is brutally expensive. I think the government needs to take a look at what kinds of investments can be made to reduce the burden, the cost burden that families face in order to access that kind of care. And then the biggest piece is a universal child care system. When we were last in government, we presented in our final budget a plan that would over time have delivered on a universal child care system, such that we've never had in the province of Ontario. I think we are well past the point of making sure that we do have that kind of social safety net in place so that, again, moms and dads, but let's face facts, it's mostly moms that this burden falls to, can actually know that there is a system in place that's accessible there are spaces available, and it's affordable, regardless of your income level, for your son or daughter to be in a childcare system that you are comfortable with, you know they're safe, and you can get back into the workforce. That, combined with making sure that there are programs and funding in place so that skills can constantly be updated, to me, those are the two halves of how we actually get more women back into the workforce, which is where we need to be.
Women were, as we just discussed, women have been affected, but so have our frontline workers as well. Can you talk about that in terms of how, frontline workers are taking up a lot of their time, personal time, and also personal safety, even risking staying away from their children and their family members to be safe? What do you think we should be doing, or the government should be doing, to help support frontline workers more?
Yeah, I mean, look, there's no other way to describe it. It's been horrifically brutal for 8, 9 months for our frontline workers in healthcare, in education, in retail, right across the board. I think we all had a sense that there were a lot of gaps in various economic sectors that we have in Ontario prior to the pandemic. But I think the pandemic has really ripped that apart and shone a very bright light onto exactly what those gaps kind of look like. So I know at various times on the healthcare side, there was what was called hero pay or pandemic pay that was temporarily provided to some of the frontline workers, but not necessarily all. I think this is all part of a much more important and bigger conversation we need to have in a province that's as prosperous as ours. How is it that so many millions of families still struggle to gain economic dignity or economic justice? It just makes no sense to me. I know the economy has shifted, but the social and economic safety net that was put in place generations ago, when the nature of work was dramatically different than it is today, has not kept pace. And so I think there needs to be that bigger discussion. It is going to be one of the really essential pillars of my election platform to talk more about economic dignity, to make sure that when we have a recovery, we're doing it from the bottom up or the grassroots up, as opposed to inadvertently increasing the income gap and the economic dignity gap. So stay tuned for more details on that front, but we definitely have a ton of work to do in that regard.
So I guess I want to get to our last conversation here. You touched on it earlier, talking about long-term care, but I wanted you to get a little more specific with that, insofar to talk about what we should be doing. In Halton specifically, we are seeing the deaths more are from the outbreaks in our long-term care and in the seniors age range. So can you talk about what we should be doing, what should the government should be doing to have more support for them?
Yeah, for sure. Listen, the stories, as I've said throughout, and many others have as well, the stories coming out of our nursing homes in Ontario have been absolutely heartbreaking and tragic. When the Canadian Armed Forces went in and did their report on the 5 homes that they were sent in to sort of deal with or rescue, those stories it absolutely was shocking. This is a problem we know in long-term care that was in place or existed before the pandemic itself. But during the pandemic, we've literally seen how the system is dysfunctional, it's broken, and it needs urgent fixing. Here, my biggest challenge with the way Doug Ford's handled this is that the pandemic started in March. The Canadian Armed Forces report was in May. Doug Ford announced an independent commission around August. Here we are now almost in December, and we've not seen any real meaningful steps made on an urgent basis to improve the situation by Doug Ford and Halton's nursing homes or those across Ontario. I think there needs to be an urgent increase to the hours of care that seniors are receiving in those homes. I don't think we can afford to wait 5 more years the way Doug Ford has suggested we should. I think there needs to be an increase to the standard of care. I think we need to talk about personal support workers, the women and men, mostly women, but women and men in those homes who do heroic work on a regular basis. They need to get paid a living wage. And that increase in pay should not end in March the way Doug Ford plans to end it. It should go on indefinitely. It should go on permanently. I think there needs to be better training and more consistent training in place to help those personal support workers do their jobs. But lastly, I think we have to have a much bigger conversation again about how people age in the province of Ontario. Long-term care is an incredibly important component of aging with dignity, but we also, because every single senior that I speak to, their last resort, their last choice is to go into a nursing home. They would much rather stay at home, in their neighborhood, in their apartment, in their home, whatever it is, but be safe and have the income sufficiency and the support through community-based home care in order to live out their golden years, again, with that kind of dignity in their own home. So Long-term care, incredibly important component. It requires urgent action right now. Doug Ford is betraying those seniors in our nursing homes in Halton and beyond, but we need to have a much bigger conversation about how one ages with dignity in Ontario.
Okay, well, thank you so much for taking the time to speak with me today, Steven.
My pleasure.
Much appreciated.
It's been great. Good seeing you. Take care.